4 fruits that secretly age seniors and 4 that reverse aging. It may surprise you that certain fruits accelerate aging more than soda. A study shows seniors eating these fruits have 57% higher risk of metabolic syndrome. These fruits promoted as healthy may be subtly harming your body daily. For adults over 65, metabolism slows and sugar tolerance significantly decreases. The wrong fruit can lead to adverse effects quite rapidly in seniors. However, certain fruits serve as natural remedies for older adults. The right fruits reduce blood pressure, enhance heart strength, and rejuvenate brain. They can make your brain function years younger than your chronological age. This guide reveals 4 fruits seniors should eat daily and 4 to avoid. Pay attention to the last danger fruit that might be depleting your energy. As we age, our bodies become more sensitive to what we consume. The foods that once caused no issues can suddenly trigger health problems. Nutrition research shows aging bodies process sugars and nutrients differently. What worked in your 40s might be harmful in your 60s and beyond. Many doctors fail to warn their patients about these dietary changes. The information you'll learn today could potentially add years to your life. Modern food processing has changed the nutritional profile of many fruits. Even natural foods aren't what they were when our grandparents were young. Agricultural practices have selected for sweeter, less nutrient-dense varieties. This makes choosing the right fruits even more critical for seniors today. Let's start with the beneficial fruits that actually reverse aging processes. These 4 options should become regular staples in every senior's diet. Berries stand out as the most advantageous fruits for seniors with age benefits. Their unique impact on cognitive function and brain health is unmatched. These small treasures are rich in anthocyanins that provide their striking hue. These compounds diminish brain inflammation and enhance neural communication. Research shows adults eating 2 servings of blueberries weekly delay aging by 2.5 years. They preserve cognitive abilities comparable to someone 2.5 years younger. A landmark study at Tufts University confirmed these remarkable brain benefits. Researchers were stunned by how quickly cognitive improvements appeared in participants. The anthocyanin compounds in berries activate specific pathways in brain cells. This triggers natural repair mechanisms that younger brains activate automatically. Berries can cross the blood-brain barrier to directly fight oxidative damage. Beyond memory, they enhance balance and coordination, preventing dangerous falls. This balance improvement comes from better neural communication in the cerebellum. Many seniors report steadier movements within just weeks of regular berry consumption. Regular berry consumption offers remarkable cardiovascular benefits for seniors. Studies show reduced blood pressure, better arterial flexibility, and lower inflammation. The Harvard Nurses' Health Study tracked these benefits over several decades. Women who ate berries 3 times weekly showed 32% lower heart attack risk. These effects quantifiably decrease heart disease risk, the top cause of senior mortality. Berries also possess remarkable capabilities for managing blood sugar levels. Their fiber and bioactive compounds stabilize glucose levels after meals. This prevents harmful spikes that worsen diabetes or pre-diabetic conditions. Unlike medications that force blood sugar down artificially, berries work naturally. They slow sugar absorption while improving your cell's insulin sensitivity gradually. Berries contain around 8 grams of fiber per cup, supporting digestive health. They facilitate regular bowel movements while being gentle on sensitive systems. This fiber acts as a prebiotic, feeding beneficial bacteria in your digestive tract. A healthier microbiome is linked to stronger immunity and better mental health. Just 1 cup daily in oatmeal, yogurt, or smoothies enhances energy and focus. Choose fresh or frozen berries, as dried varieties often contain added sugars. Frozen berries actually maintain more nutrients than fresh ones stored too long. They're flash frozen at peak ripeness, preserving their beneficial compounds effectively. Wild berries contain up to 10 times more antioxidants than cultivated varieties. If available, choose smaller, more intensely colored berries for maximum benefits. Pomegranate might not seem an obvious choice yet serves seniors' heart health well. With age, arteries stiffen, decreasing blood flow and increasing blood pressure. Pomegranates contain abundant punicalagins that decrease arterial oxidative stress by 30%. Research shows these antioxidants are 3 times stronger than red wine or green tea. These compounds specifically target arterial plaque, the hardened material causing blockages. Clinical studies show pomegranate reversing arterial damage in as little as 90 days. Oxidative stress causes inflammation and narrows arterial walls like rust in pipes. Punicalagins remove this rust, resulting in smoother and more efficient blood flow. The Mediterranean regions with highest longevity consume pomegranates regularly. These populations enjoy remarkably low rates of heart disease despite advanced age. Studies show pomegranate juice reduces systolic blood pressure by 5 to 21%. This benefit is significant for seniors seeking to control pressure with less medication. The juice works by producing nitric oxide, the same compound heart medications target. This naturally dilates blood vessels without the side effects of pharmaceutical drugs. Beyond heart benefits, pomegranate enhances memory and cognitive function considerably. A UCLA study revealed seniors drinking it daily showed improved verbal memory. Participants could remember 28% more words on memory tests after daily consumption. These improvements were most dramatic in seniors who had mild memory complaints. This is essential as memory loss ranks among the most concerning age consequences. Pomegranate juice provides advantages without the need for difficult chewing. The juice contains over 100 phytochemicals working synergistically for brain health. These compounds reduce the formation of amyloid plaques associated with dementia. You don't need a full glass daily to experience significant benefits. Just half a cup of seeds or some juice in your morning smoothie works well. The arils or seed pods contain beneficial fiber not found in the juice alone. They provide a satisfying crunch while delivering maximum nutritional benefits. Pomegranate stands out among sugary fruits due to its low glycemic index. This makes it excellent for older adults managing pre-diabetes or type 2 diabetes. The unique sugar structure in pomegranates doesn't spike blood glucose like other fruits. Your pancreas doesn't have to work as hard to process these natural sugars. Choose pomegranate juice that's entirely pure with no added sugars involved. If taking blood thinners, consult your doctor as pomegranates may interact. The interaction is due to vitamin K content that affects blood clotting factors. Most doctors simply recommend consistent rather than variable pomegranate consumption. Apples are incredibly rich in fiber, particularly pectin that feeds gut bacteria. A healthier gut leads to better digestion, immunity, and nutrient absorption. The old saying, "An apple a day keeps the doctor away," has scientific merit. Regular apple eaters visit their physicians 30% less often than non-apple eaters. What makes apples impressive is their effect on cholesterol and heart health. Pectin interacts with cholesterol, facilitating removal and reducing LDL levels. This cholesterol binding effect can lower LDL levels by up to 40% over time. It's comparable to low-dose statin medications but without pharmaceutical side effects. Apples contain flavonoids like quercetin that reduce inflammation and enhance heart health. They significantly contribute to blood sugar regulation despite their sweetness. Quercetin specifically targets inflammatory pathways involved in arterial disease. This compound becomes more concentrated in slightly underripe or tart apple varieties. Apples possess low glycemic load, and fiber moderates sugar absorption effectively. This prevents spikes and crashes, benefiting seniors with insulin resistance or diabetes. The fiber creates a gel-like substance that slows digestion in the small intestine. This gradual release of nutrients provides sustained energy without fatigue. Apples are filling thanks to fiber and water content, aiding appetite control. A lesser-known fact is that chewing apples stimulates saliva production. Studies show eating an apple before meals reduces calorie intake by nearly 15%. This natural appetite regulation helps maintain healthy weight without feeling deprived. This helps reduce cavities and gum disease, issues more common with age. Whether red, green, or yellow, apples benefit nearly every bodily system. Green apples contain more pectin and less sugar than red or yellow varieties. Choose firmer, slightly tart apples for maximum blood sugar management benefits. The apple skin contains most of the beneficial compounds, so avoid peeling them. Simply wash thoroughly with water and a brush to remove any surface residue. Avocado is classified as a fruit and deserves a distinguished place for seniors. Unlike old guidelines discouraging fats, avocados are advantageous for seniors' diets. Nutritional science has reversed its position on dietary fats in recent decades. We now know certain fats are essential for brain health and hormonal balance. Avocados contain substantial monounsaturated fats, particularly oleic acid. This lowers harmful LDL cholesterol while enhancing beneficial HDL cholesterol. This fat profile mirrors the Mediterranean diet associated with exceptional longevity. Regular avocado consumers show significantly lower rates of heart disease over time. This unique fat composition benefits older adults with cardiovascular issues. Enhanced cholesterol levels link to lower heart attack and stroke likelihood. The fats in avocados also improve absorption of fat-soluble vitamins A, D, E and K. These vitamins are essential for bone health, immunity and cellular repair. Many seniors don't know avocados have more potassium than bananas, around 975 milligrams. This benefits blood pressure management, crucial as hypertension affects 2/3 of seniors. Most Americans consume only half their recommended daily potassium intake. Just half an avocado provides nearly 20% of your daily potassium needs. Potassium counteracts sodium intake and promotes blood vessel wall relaxation. This effectively lowers blood pressure without requiring extra medication. Clinical studies show avocado consumption can lower systolic pressure by 5-7 points. This reduction is comparable to what many prescription medications achieve. Avocados are rich in lutein, an antioxidant beneficial for eye health. Research shows lutein slows age-related macular degeneration progression. The macula contains the highest concentration of lutein in the human body. Regular consumption rebuilds these protective layers in the retina over time. An overlooked advantage is avocado's ability to enhance nutrient absorption. Many vitamins in vegetables are fat-soluble, requiring fat for absorption. Without adequate fat, your body simply excretes these valuable nutrients unused. The avocado's fat profile is perfectly suited for maximum vitamin absorption. Adding avocado to salads enhances nutrient absorption up to 15 times. This maximizes nutritional value without relying heavily on supplements. Research shows seniors taking supplements absorb far less than from whole foods. The synergistic effect of nutrients in foods exceeds isolated supplement benefits. Just half an avocado daily is enough to reap all these benefits. Spread it on toast, mix in smoothies, or eat with lemon. Avocados ripen after harvesting, so buy them firm and let them soften. Store ripe avocados in the refrigerator to extend their usable life. Now for the fruits that can harm seniors, starting with a surprising danger. Grapefruit tops our list despite being lauded for health benefits. The pharmaceutical industry has known about grapefruit dangers for decades. Many medication labels specifically warn against consumption with this fruit. Grapefruit contains furanocoumarins that block the intestinal enzyme CYP3A4. This enzyme metabolizes around 85 distinct medications commonly prescribed to seniors. These compounds are particularly concentrated in white grapefruit varieties. Even ruby red and pink varieties contain enough to cause dangerous interactions. Blocking this enzyme causes dangerously elevated medication levels in your bloodstream. It's like receiving a much higher dose than prescribed despite taking correct amounts. A single glass of juice can increase drug concentration by 200,400%. This effect can last up to 72 hours after eating the fruit or drinking the juice. This can significantly escalate side effects, some serious or life-threatening. The range of affected medications is broad, including many senior prescriptions. Most patients are never properly warned about these dangerous interactions. Many doctors and pharmacists fail to emphasize the severity of the risk. These include statins for cholesterol like atorvastatin, lovastatin, and simvastatin. Also affected are blood pressure medications, anti-anxiety drugs, and antihistamines. Blood pressure medications can drop pressure dangerously low when combined with grapefruit. This increases fall risk and can cause dangerous episodes of lightheadedness. Grapefruit with Lipitor can increase drug concentration by over 400%. This heightens risk of severe side effects like muscle breakdown and kidney failure. Many psychiatric medications, including anti-anxiety drugs, interact similarly. Grapefruit consumption can lead to dangerous sedation or altered mental states. Even small amounts of grapefruit can initiate dangerous interactions with medications. Effects can linger for 72 hours, so staggering consumption doesn't help. Unfortunately, grapefruit compounds aren't destroyed by processing or cooking. Even marmalade made from grapefruit can contain enough to cause interactions. Consult your doctor about grapefruit safety if taking any prescription medication. This seemingly harmless fruit possesses concealed potential for dangerous interactions. Alternative citrus fruits like oranges and tangerines don't share these risks. Switch to these options if you enjoy citrus but take medications regularly. While ripe bananas can be nutritious, unripe bananas pose significant health concerns. The primary issue lies in their high resistant starch content. Resistant starch earned its name because it resists digestion in the stomach. It passes to the large intestine largely intact, causing fermentation and gas. This starch resists digestion, unlike easily digestible sugars in ripe bananas. For seniors with reduced digestive enzymes, this causes considerable discomfort. Digestive enzyme production naturally declines by up to 30% after age 60. This makes previously digestible foods suddenly problematic for many seniors. Unripe bananas can cause bloating, gas, and abdominal pain in sensitive seniors. The issue worsens for those with irritable bowel syndrome or inflammatory conditions. The resistant starch ferments in the colon, producing excessive gas and discomfort. This can trigger painful spasms in those with sensitive digestive systems. Digestion problems extend beyond discomfort to hindering nutrient absorption. This challenges seniors already facing nutrient deficiencies from various causes. When the digestive system is irritated, it absorbs fewer nutrients from all foods. This creates a cascade effect potentially leading to multiple deficiencies over time. Astringent compounds in green bananas irritate sensitive digestive tract linings. This potentially leads to inflammatory responses in the gut. These compounds cause the dry, chalky mouthfeel characteristic of unripe bananas. They can trigger similar astringent reactions throughout the digestive tract. Unripe bananas have fewer antioxidants than ripe ones with brown spots. These beneficial compounds increase considerably throughout the ripening process. A banana with brown spots contains 8 times more antioxidants than a green one. The ripening process converts starches to sugars while developing beneficial compounds. For seniors seeking anti-inflammatory benefits, unripe bananas are unsuitable options. But there's an even more deceptive fruit danger in many seniors' pantries. Wait for bananas to develop small brown spots for maximum digestibility. At this stage, they provide potassium and natural sugars without digestive strain. Dried fruits, especially commercially processed ones, pose significant challenges. Despite appearing healthy and convenient, they concentrate sugar dangerously. Many seniors choose dried fruits believing they're making a healthy choice. The health food marketing around these products is particularly misleading. During drying, water removal results in highly concentrated fruit sugar. A small handful of dried apricots equals several whole fresh ones in sugar. The dehydration process removes water while leaving all the sugar behind. This creates a dangerously concentrated sweet food that's easy to overconsume. This makes it easy to consume excessive fructose without fiber's fullness signals. This concentration particularly endangers seniors managing diabetes or insulin resistance. The compact nature of dried fruit leads to portion control difficulties. Most people eat 3-4 times more dried fruit than they would fresh fruit. Even small quantities cause dramatic blood glucose spikes, harmful over time. This can lead to type 2 diabetes or make existing diabetes harder to manage. These repeated blood sugar spikes damage small blood vessels throughout the body. The cumulative effect accelerates aging in virtually every organ system. Sugar spikes increase inflammation, worsening arthritis pain and cognitive decline. They also weaken the immune system, something seniors cannot afford to compromise. Inflammation is now recognized as the root cause of most age-related diseases. Anything that increases inflammatory markers accelerates the aging process significantly. Commercial dried fruits often contain sulfites to maintain color and extend shelf life. These preservatives trigger severe asthmatic reactions in sensitive individuals. These sulfite compounds are particularly problematic in dried apricots and raisins. The distinctive bright orange color of commercial dried apricots comes from sulfites. Seniors are particularly vulnerable due to age-related respiratory function changes. About 1 in 100 people have sulfite sensitivity, higher among seniors with conditions. This sensitivity often develops with age, even in people without previous reactions. Symptoms include wheezing, coughing, and in severe cases, difficulty breathing. Many dried fruits also contain added sugars to enhance flavor and preservation. This double sugar effect makes them even more problematic for blood glucose. Look for unsulfured, no added sugar versions if you must consume dried fruits. Better yet, choose fresh fruits that provide hydration along with nutrients. The final danger: fruit may surprise you as it seems like a healthy snack. Grapes appear benign and nutritious but present unexpected challenges for seniors. Their sweet, convenient nature makes them a popular choice among older adults. Unfortunately, this convenience comes with significant metabolic drawbacks. The significant issue is their high sugar content paired with very low fiber. Grapes contain glucose-fructose sugar that enters bloodstream extremely quickly. This sugar blend is remarkably similar to high fructose corn syrup in effects. It causes rapid blood sugar elevation followed by insulin surges and energy crashes. Their bite-sized nature makes it easy to consume more sugar than you realize. A single cup contains 23 grams of sugar, equivalent to a small candy bar. Most people eat grapes by the handful without realizing how much they're consuming. It's common to eat 2-3 cups in a sitting, delivering as much sugar as a soda. The lack of fiber allows swift sugar absorption, causing glucose and insulin spikes. These fluctuations associate with weight gain, inflammation, and increased diabetes risk. Over time, these spikes contribute to insulin resistance and metabolic syndrome. This condition significantly increases heart disease and stroke risk in seniors. Another concern is that non-organic grapes frequently carry pesticide residues. Seniors with compromised immune systems are particularly susceptible to these toxins. Grapes consistently rank in the dirty dozen for highest pesticide contamination. Their thin skins offer little protection against chemical penetration. Grape skin provides limited nutritional benefits compared to apples or pears. Though they appear harmless, they pose significant risks to seniors' metabolic health. The resveratrol in grape skins, while beneficial, exists in extremely small amounts. You'd need to consume hundreds of grapes to get therapeutic levels. If you enjoy grapes, limit portions strictly and pair with protein. Even better, choose berries instead for similar sweetness with far fewer risks. This analysis shows which fruits help seniors and which secretly harm them. Avocados, apples, pomegranates, and berries contribute to slower aging process. The beneficial fruits contain compounds that actually repair age-related damage. Their effects are cumulative, becoming more pronounced with regular consumption. They enhance cognitive function and increase physical strength significantly. However, grapefruit, dried fruits, unripe bananas, and grapes undermine health. The harmful fruits create metabolic chaos that accelerates the aging process. Their effects compound over time, gradually eroding health and vitality. These seemingly innocent choices elevate blood sugar and contribute to inflammation. The unsettling aspect lies in the subtlety of this damage over time. You won't feel immediate effects, making these fruits particularly dangerous. The damage accumulates silently until health problems suddenly emerge. Many remain unaware that small servings of these fruits trigger complications. Most only realize when the consequences become apparent and damage is done. Making these dietary changes can potentially add healthy years to your life. The benefits compound with each passing month of improved fruit choices. Select your fruits with care and consume with awareness for better aging. Whenever possible, pair fruit with protein or healthy fat to slow sugar absorption. This simple pairing strategy reduces glycemic impact by up to 70%. Just adding a handful of nuts or cheese makes fruit much safer for seniors. Are you consuming potentially harmful fruits without knowing the risks? Which revelation caught you off guard the most? Share in the comments below. Have you experienced unexplained health issues that might connect to these fruits? Your experience could help others recognize similar patterns in their own health. Remember, small daily choices create your long-term health outcomes. Choose your fruits wisely and enjoy vibrant health well into your golden years.